Welcome to the module on lifting and moving patients. By the end of this module, you will be able to define body mechanics, explain 3 emergency moves and 2 non-emergency moves for lifting and moving a patient, define the techniques for moving patients, explain 5 examples of situations that might require you to make an emergency move with a patient, list the equipment and devices for carrying patients, and understand the role of volunteers. Before lifting or moving a patient, it is very important to make a plan so that we do not injure the patients further. This planning includes estimating the weight of the patient to be lifted. It is essential to recognize your limitations and never attempt to lift or move a patient who is beyond your capacity. Hence, if required, additional help should be taken. In this module, you will learn about the process of lifting and moving patients. Body mechanics refers to the use of our body to facilitate lifting and moving of patients to minimize injury. Body mechanics is about the posture we should maintain as we sit, stand, or bend while lifting or carrying patients. It involves standing and moving one's body correctly and making the best use of one's strength to prevent injury. The proper and efficient use of body mechanics by a rescuer is crucial during the process of lifting and moving a patient or victim from the incident site or operational area. This approach is essential to ensure the well-being of the patient, facilitate immediate treatment, and provide a better cure. When you learn how to control and balance your body, you can safely move another person. When you are lifting someone heavy, proper body mechanics will help prevent any back injuries to yourself. Let's look at some general rules for lifting and moving patients. These rules minimize the chance of injury. Position your feet properly. They should be on a firm, leveled surface and positioned at a comfortable width apart. Take extra care if the surface is slippery or unstable. Lift with your legs. Keep your back as straight as possible and bend at your knees. Don't try to bend the waist and keep eyes on your partner. This technique is known as a power lift. When lifting with one hand, avoid leaning to either side. Bend your knees to grasp and keep your back straight. Minimize twisting during a lift. Keep the weight as close to your body as possible. It can reduce any chance of injury. When carrying a patient on a stairway, use a stair chair instead of a wheeled stretcher. Whenever possible, have a rescuer watch you as you walk backwards down the stairs. Do not lift from a twisted or sideways position. Do not lift from a forward stooped or imbalanced position. Apply these principles for lifting, pulling, pushing, carrying, moving or reaching. The key to preventing injury is correct alignment of the spine. Keep a normal inward curve of the lower back. Keep wrist and knees in normal alignment. Teamwork is essential. Communicate during a task, clearly and frequently. Use commands that are easy for team members to understand. Verbally coordinate moves from beginning to end. A proactive, well-balanced physical fitness program would be helpful. It should include training in flexibility, cardiovascular exercise, strength and nutrition. Patient moving techniques can be classified as emergency moves and non-emergency moves. In situations where the scene is hazardous, immediate patient care is required, or there's a need to reach another patient who needs life-saving care, an emergency move is performed. When the situation is not urgent, the patient is stable, or you have adequate time and personnel for a move, a non-emergency move is preferred. Emergency moves are made quickly. There is no spinal stabilization. It is performed when the scene is not safe, and there is an immediate danger to both the patient and the rescuer. Some situations that might require emergency moves are fire or threat of fire, which is always considered a great threat to patients and rescuers, explosion or threat of explosion, which is hazardous, inability to protect the patient from hazards at the scene, unstable building, rolled over car, hostile crowd, hazardous materials, spilled gasoline, extreme weather. Emergency moves are also made to gain access to other patients who need care. There is a need to make an emergency move when life-saving care cannot be given due to patient's location or position. The greatest danger in making an emergency move is the possibility of aggravating a spinal injury. Provide as much protection to the spine as possible. Pull the patient in the direction of the long axis of the body. Try not to move the head away from the neck and shoulders and secure the hands and arms. Move the patient only under conditions when emergency move is necessary. Some types of emergency moves are shirt drag, shoulder or forearm drag, blanket drag. Other types of emergency moves: piggyback carry, cradle carry, firefighters carry, one rescuer assist, to rescuer assist. Click each type to know more. Grasp the person's clothing behind the neck, gathering enough to secure a firm grip. Using the clothing, pull the person headfirst to safety. During this move, the person's head is cradled by clothing and the rescuer's arms. This move is exhausting and may cause back strain for the rescuer, even when done properly. Place your hands under the patient's armpits from the back and grasp the patient's forearms. Used to move a heavy patient. Offers some protection for the head and neck. Gather half of the blanket material up against the patient's side. Roll the patient toward your knees so that you can place the blanket under him. Gently roll the patient back onto the blanket. During the drag, keep the patient's head as low as possible. Assist the patient to stand. Place his or her arms over your shoulder so that they cross your chest. Bend over and lift. While he or she holds on with his or her arms, crouch and grasp each thigh. Use a lifting motion to move him or her onto your back. Pass your forearms under his or her knees and grasp his or her wrists. Place one arm across the patient's back with your hand under his or her arm. Place your other arm under his or her knees and lift. If your patient is conscious, have him or her place his or her near arm over your shoulder. Place the patient on his or her back and secure his or her hands together with tape or roller gauze. Straddle the patient, facing his or her head, and then crouch. Move on your hands and knees. Keep the patient's head as low as possible. Place the patient's arm around your neck, grasping his or her hand in yours. Place your other arm around the patient's waist. Help him or her walk to safety. Be prepared to change technique if level of danger increases. Be sure to communicate with the patient about obstacles, uneven terrain, and so on. Patient's arms are placed around the shoulders of both rescuers. Each rescuer grips one of the patient's hands, places a free arm around the patient's waist, and helps him or her walk to safety. Next, let's learn about non-emergency moves. Non-emergency moves should be carried out with the help of other trained personnel or bystanders. Take care to prevent additional injury to the patient, as well as to avoid patient discomfort and pain. Use a minimum of 3 rescuers whenever possible. If possible and when in doubt, always suspect spinal injury and provide full spinal immobilization on a backboard before moving. For example, a patient out of a car crash should always be immobilized even if he or she appears well. Where there is no immediate threat to life, the patient should be moved only when ready for transport using a non-emergency move. Some non-emergency moves are direct ground or bed lift and extremity lift. Click each type to know more. The direct ground lift is a 3-rescuer non-emergency move that can be used to move a patient from the ground or floor to a bed or stretcher. This move is not recommended for use on patients with possible neck or spine injuries, although it can be carried out by 2 people. 3 are recommended. To perform a direct ground lift, the patient should be lying face up, supine, and his arms should be placed on the chest. You and your helpers should line up on one side of the patient. One rescuer should be at the patient's head, another at his or her midsection, and the third at the feet. Each rescuer should drop to the knee that is closer to the patient's feet. The rescuer at the head should place one arm under the patient's neck and grasp the far shoulder in order to cradle the head. The other arm should be placed under the back, just above the waist. The rescuer at his or her midsection should place one arm above and one arm below the buttocks. The rescuer at the patient's lower legs should place one arm under his or her knees and the other arm under the ankles. First, on the signal of the rescuer at the head, everyone should lift the patient up to their knee level. Then, on signal, the rescuers should roll the patient towards their chests. Finally, on signal, everyone should stand up while holding the patient. You can now move him or her, reversing the process when it is time to place the patient back in a supine position. An extremity lift requires 2 people. This lift is ideal for moving a patient from the ground to a chair or a stretcher. It can be also used to move a patient from a chair to the stretcher. However, it should not be performed if there is a possibility of head, neck, spine, shoulder, hip, or knee injury, or any suspected fractures to the extremities that have not been immobilized. The patient should be placed face up, with the knees flexed. You should kneel at the head of the patient, placing your hands under his or her shoulders. Have your helper stand at the patient's feet and grasp his or her waist. Direct your helper to pull the patient into a sitting position while you push the patient from the shoulders. Do not let your helper pull the patient by the arms if there are any signs of suspected fractures. Slip your arms under the patient's armpits and grasp the wrists. Once the patient is in a semi-sitting position, have your helper crouch down and grasp the patient's legs behind the knees. Next, let's learn about positioning a patient. How you position a patient depends on the patient's condition. For example, A patient showing signs of shock may be placed in the shock position, that is, elevate legs or feet on the end of a long spine board 20 to 30 centimeters. Patient with respiratory problems may get into a more comfortable position unless injuries prevent it. These patients generally want to sit up. Patients with abdominal pain generally want to be on one side with legs drawn up. A responsive patient who is nauseated or vomiting should be allowed to remain in a position of comfort unless injuries prevent it. Always be ready to manage the patient's airway. Trauma patients, especially suspected with spinal injury, should be appropriately immobilized on a long spine board. Place patient in recovery position if unconscious and not contraindicated. Obviously, it is not possible to address every situation. Conditions at the scene and the patient's condition will dictate a good position for the patient. Let us next learn about patient carrying equipment. EMTs and Advanced Life Support (ALS) personnel will often ask emergency medical responders to assist with preparing the patient for transport and with lifting and loading patients into the ambulance. To help with these tasks, you must be familiar with various carrying and packaging devices that are used. Many emergency medical responder courses do not include information and practice on immobilization equipment. Such types of equipment include stretchers and other devices designed to carry patients safely to their destination. You should become completely familiar with the use of such equipment. You must also know the limitations of such equipment. It is very important to regularly maintain and inspect the equipment. Let's take a look at some of the equipment. Some patient-carrying equipments are lightweight portable stretcher, wheel stretcher, scoop stretcher, vest-type extrication device, draw sheet, spine board or backboard, and improvised stretcher. Click each equipment to know more. The lightweight portable stretcher is also known as a folding or flat stretcher. It is much lighter than a standard wheeled stretcher and makes the task of moving a patient downstairs or out of tight spaces much easier. Portable stretchers may be canvas, aluminum, or heavy plastic, and they usually fold, roll up, or collapse for easy storage. Aluminum and plastic stretchers are now commonly used because it is easy to disinfect them. Wheel stretchers are used generally for ambulances. It is a collapsible wheeled stretcher on a variable height wheeled frame. Normally, an integral lock on the stretcher locks into a sprung latch within the ambulance in order to prevent movement during transport. It also has straps to secure the patient. The stretcher is usually covered with a disposable sheet and cleaned after each evacuation in order to prevent the spread of infection. Its key value is to facilitate moving patients to hospitals. The scoop stretcher or clamshell, Robertson orthopedic stretcher, or just scoop, is a device used specifically for moving injured people. It is most frequently used to lift people from the ground who may have a spinal cord injury. They have to be so lifted either due to unconsciousness or in order to maintain stability in the case of trauma. Vest-type extrication devices facilitate the extrication of a seated patient while stabilizing the patient's head, neck, and spine. It is commonly used in vehicle extrication. The different types of vest-type extrication devices are stair chair, basket stretcher, and flexible stretcher. The stair chair helps rescuers move seated medical patients down stairways and through places where a traditional stretcher will not fit. Newer brands are made of sturdy folding frames with either canvas or hard plastic seats and are easy to store. They have wheels that allow rescuers to roll them over flat surfaces. Some models have a tractor tread mechanism that allows them to easily slide down stairways just by tilting them. Basket stretcher is made of metal or strong synthetic material in which a patient is placed so he or she can be securely extricated by emergency medical services from an accident or otherwise inaccessible site. The stretcher may also be lifted by ropes. The basket stretcher is also known as a stroke stretcher. Flexible stretcher is made of rubberized canvas or other flexible material such as heavy plastic, often with wooden slats sewn into pockets. The flexible stretcher usually has 3 carrying handles on each side. Because of its flexibility, it can be useful in confined spaces or narrow hallways. A draw sheet is a small bed sheet placed crosswise over the middle of the bottom sheet of a mattress to cover the area between the patient's upper back and thighs. It is often used by medical professionals to move patients. It can be made of plastic, rubber, or cotton, and is about half the size of a regular sheet. It can be used in place of a mattress pad if a rubber mattress is used. The draw sheet may or may not be tucked into the sides of the bed. Backboard is a stiff board on which an injured person, especially one with neck or spinal injuries, is placed and immobilized in order to prevent further injury during transport. These devices are usually made of splinter-resistant wood or synthetic material that will not absorb blood. They usually have handholds or carrying straps. There are 2 types. Long backboard, 6 to 7 feet long, used for patients found lying down and needing immobilization. Short backboard, 3 to 4 feet long, used primarily to remove patients from vehicles when neck or spinal injuries are suspected. The backboard is slid between the patient's back and the seat. Once secured to the short board and wearing a rigid cervical collar, the patient can be removed from his sitting position in the vehicle to a supine position on the long board. Vest-type devices are often used as a short backboard. Improvised stretcher can also be made out of 2 wooden bamboo shafts and T-shirt just by inserting the shafts through the 2 arms of the T-shirt as explained in the diagram. 2 T-shirts can be used to further strengthen the weight-carrying capacity of the improvised stretcher. Next, let's learn about the role of volunteers in lifting and moving patients. Volunteers can help in many ways. Volunteers can help responders in ensuring the safety of victims by clearing hazards present at the incident site. Volunteers can help rescuers in carrying injured victims, manually or on a stretcher. They can also help MFRs in dressing and stabilization of injured victims. Volunteers must be aware that certain patient conditions call for special techniques so that injuries do not get aggravated. In such conditions, wait for a medic or doctor. Volunteers may help medical staff in the maintenance of basic life support system. With this, we have come to the end of this module. The key points discussed in this module are: Body mechanics refers to the use of our body to facilitate lifting and moving of patients to minimize injury. The proper and efficient use of body mechanics by a rescuer is crucial during the process of lifting and moving a patient or victim from the incident site or operational area. Patient moving techniques can be classified as emergency moves and non-emergency moves. The greatest danger in making an emergency move is the possibility of aggravating a spinal injury. Non-emergency moves should be carried out with the help of other trained personnel or bystanders, emergency medical technicians or EMTs, and advanced life support or ALS personnel will often ask emergency medical responders or EMRs to assist with preparing the patient for transport and with lifting and loading patients into the ambulance. Hence, it is important for responders to know the different types of equipment and techniques of lifting and moving patients. Now, it is time to check your understanding of the topic. This is an evaluation exercise. All questions are equally weighted. You need to score at least 60% to pass the test. Read the questions carefully and select the appropriate options. Congratulations!